Hi, this is Margie with Flow Motion Education. In this video, I'm going to present a very rudimentary introduction to shoulder joint mechanics. Before we dive into the mechanics, let's make sure we are clear on what exactly the shoulder joint is. So a joint is where two bones come together, and in this case, the two bones are the upper arm bone, or technically known as the humerus, and I actually encourage you to wrap your hands around your upper arm, and you can, if you dig in, you can feel, oh, there's a bone. That's this one. The other member of this team, or this joint, is the shoulder blade, or scapula. It also has a collar, there's a collarbone that's actually a separate bone, and yes, it is very involved in shoulder joint mechanics, but I'm actually not going to discuss it in this video. I'm going to really stick to the shoulder joint and the rib cage. So the actual joint is the articulation between these two bones. And you can perhaps see there's a little bit of a concavity in the part of the scapula or shoulder blade that articulates with the humerus or upper arm bone. And the upper arm bone has a round knob at the top, and it is considered a ball and socket joint. I don't think it's really a ball and socket, but it does have the mechanics of a ball and socket joint. It actually has more range of motion than any other joint in the body. And if you think about it, that's probably not a big surprise. We do a heck of a lot with this shoulder joint. So we can hang, we can reach, we can throw, we can lift, we can push, we can pull, and the shoulder joint is the conduit to your upper extremity, and in particular your hand. So this is not a really big space, this joint, and so there's not a lot of room for error. We want things nicely aligned within this joint, because all of your arteries and veins and nerves that communicate between the brain and the spinal cord and your hand, little kind of important nerves there, and arteries and veins, by the way, have to all go through this joint. That's a lot of activity. And then there's the bone. So there's a lot going on in that joint, and we really need it to be in alignment for optimal mechanics. So again, it's the joint between the upper arm bone or humerus, which has the ball part, and the shoulder blade or scapula, which has the socket part. I'm going to give you a little geek hint here, and I'll talk more about this in a future video where I dive down the rabbit hole of the shoulder joint. But my little hint is, geek hint, very geek hint. I'm guessing most of you have heard of the rotator cuff, even if you don't know exactly what it is. And my little teaser hint is that the function of the rotator cuff muscles is to turn this kind of ball and socket into a functional ball and socket. Their function is what's called joint centration, which means actually they're turning it into a functional ball and socket, as if there were some depth to the socket. It's not really a ball and socket. I have a teacher that calls it more like a golf ball on a tee. To put the shoulder joint in context, I think I should name this guy. If anybody has suggestions, please email me. All my colleagues seem to have named their skeletons. I'm behind the times. But anyway, to put the shoulder joint in context, rib cage, back of the rib cage, shoulder blade or scapula, upper arm bone, that's your shoulder joint. I want you to notice something kind of interesting about the shoulder joint. Its connection to the rest of the body is via the shoulder blade resting on the rib cage. And I'm pointing that out because this is actually really important in understanding shoulder joint biomechanics. So first we're going to talk about the motions that happen at the shoulder joint, just the joint between the scapula or shoulder blade and humerus or upper arm bone. And then I'm going to talk about the motion that occurs between the shoulder blade and the rib cage. Not technically a joint, but we're going to kind of consider it a joint in this discussion. Okay, so movement available at this joint that has more range of motion than any other joint in your body, which perhaps makes it more vulnerable in some ways if you think about it, are you can reach forward. Actually, I encourage you to do this with me. So you can reach forward and all the way up overhead. And you can reach back and hopefully not all the way up overhead, or I'll be a little worried about your shoulder joint. And you can reach out to the side and up overhead. And you can reach across the body. So the movements we've done so far are pretty easy to conceptualize, I think. Shoulder blade, rib cage, and you can reach forward, you can reach back. All of that is the ball rotating in the socket. You can reach out to the side, still the ball all the way up overhead, the ball rotating in the socket, and you can reach across the body. So I think those movements are pretty easy to visualize what the bones are doing. I'm actually going to name them anatomically because I have a fair number of people who take my courses or who study with me privately who have a background in anatomy. So just for completeness, reaching out to the side and up overhead is called shoulder abduction, ABD, abduction. Adduction is crossing the body, ADD. Shoulder flexion is reaching forward, and you can go as far as up overhead. And shoulder extension is reaching back. And all of those are the ball rotating in the socket. So the next movement is called internal and external rotation, or rotating your arm in, rotating your arm out. And again, it's still the ball rotating in the socket. Okay, so what I want you to do is hold on to your upper arm. And I want you to hold on just hard enough that you're actually holding it still. Just a little more. And I want you to rotate your palm to face back and forward. And I want you to notice that that movement is not occurring at the shoulder joint. In other words, your upper arm bone is not moving. So I want to make it clear that we have separate motions at the elbow or forearm and the shoulder joint. I do want to differentiate them, even though they're coupled and you really can't have one without the other. Or you certainly, it's very difficult to have motion at the shoulder joint without any motion at the forearm. They're very coupled functionally. So you're holding your upper arm bone and you're holding it still. You don't have to squeeze it so it hurts, but hold it still. And then just notice you can actually rotate your palm. That motion is coming from, it's a complicated motion and I'm not going to describe it in the video, but let's just say it's not coming from the shoulder joint. It's coming from the elbow, forearm, and technically there's radius and ulna, and one is crossing over the other. If you get interested, go Google it. It's forearm pronation and supination. But we're going to now go on. So you're going to, again, hold the upper arm bone still, rotate your palm so that it's facing back, saying to yourself, well, that's not happening at the shoulder joint. That's happening at the elbow and the forearm. Then release your arm, but now keep your hand cupped so you're not preventing motion, but you're listening, and continue that rotation, and then you'll feel the upper arm bone or humerus rotating under your hand. And that is shoulder joint motion. In fact, that is internal rotation. The arm is rotating in toward the midline of the body. Now we're going to do external rotation, or it's still the ball rotating in the socket, but now it's rotating out. The upper arm bone is rotating out or away from the midline of the body. External rotation. Again, hold your upper arm bone still. Let's start this time with the palm facing us. So it's facing your thigh, or if you're standing, or your chair if you're sitting. And start by rotating it out so the palm is facing forward. And just notice, oh, that did not come from the shoulder joint, that motion. My upper arm bone did not move. And remember, my upper arm bone is part of the shoulder joint. So that is not shoulder motion. Again, that's that forearm supination. This is forearm pronation. This is forearm supination, not a shoulder motion. However, let's start again with the hand facing us. Go into your forearm supination. Don't let the upper arm bone rotate. Rotate the palm to face forward. And then to continue the rotation, release the hold on your upper arm bone, but keep the hand cupped and listen. Oh yeah, now I feel the arm bone rotating. Those motions are very coupled. So it's okay if I cue you to externally rotate the shoulder if you initiate at the hand and then first move the forearm and then move the shoulder. And I don't even care if you don't think about it that way. I just want to make sure that you are aware that if you just do this, you are not rotating your shoulder. I want to make sure that when I cue you to rotate the shoulder joint, it is actually the upper arm bone that is rotating. So remember I said we can't talk about the shoulder joint, motion at the shoulder joint, without talking about shoulder motion between the shoulder blade and the rib cage. And we're going to experience these motions together, because describing them, you'll go, what is she talking about? But the minute you do them, you'll go, oh yeah, actually those are kind of familiar motions. I get it. So the motions are my giant shoulder blade on the skeleton. The shoulder blade articulates with the rib cage and it glides on the rib cage. And the reason I have to bring this up is you cannot have functional end range shoulder joint motion, the motion here, without coupling it with the shoulder blade gliding on the rib cage. You cannot get to end range functionally without movement between the shoulder blade and the rib cage. In fact, there's I'm going to get a little geeky, as I'm known to do. There's a name for shoulder blade, shoulder joint motion. So remember, the shoulder blade is the scapula, and the upper arm bone is the humerus, and it's called scapulohumeral rhythm. So whenever the shoulder joint moves to end range, there has to be movement of the shoulder blade as well, and the shoulder blade will be gliding on the rib cage. So it can glide up, and it can glide down, and it can glide away from the spine, and it can glide toward the spine. And we're going to do those motions, and because that probably sounds a little bit, well, that's a little hard to conceptualize, but we're going to make it easy because you're going to do it and you'll be able to feel it. So your shoulder blades are if you shrug your shoulders way up around your ears, that movement comes from your shoulder blades gliding up your rib cage. And in fact, if you're in a position to be with somebody else that you're comfortable touching their back, I recommend you actually put your hands on someone's shoulder blades and ask them to shrug and feel them glide up the rib cage. And then, of course, if they can glide it, what goes up must go down, so they can glide down the rib cage. And they can glide apart, so that's my shoulder blade sliding away from the spine. So they can glide apart, and they can glide together. Okay, so we have visited abduction, or reaching out to the side and up overhead. And I encourage you to just say to yourself, you know, Margie says my shoulder blade needs to move too, so just allow it to move and just see what happens. And then, so that's abduction, adduction, reaching across the body, extension or reaching behind, flexion or reaching in front, and this one again, you can reach all the way overhead. And then we have the internal rotation and the external rotation, making sure that it's not just your forearm that's moving, but the shoulder joint as well. So you really should feel the upper arm bone moving. And finally, now, if you have any shoulder issues, I recommend that you perhaps don't do the full range of motion that I'm about to demonstrate. And no matter what, I want you to do it very mindfully. But this is a completely functional movement of the shoulder that we should be able to retain or regain. Again, if you haven't done anything like this in a while, or you're in a vulnerable place with an injury that's healing or a long-term injury, I want you to make this very small. Don't do the whole circle, but it's called circumduction, and that is where I do a full circle with my arm, and then you can circumduct in both directions. So that would look like this from the front. And I don't know if there's a name for this, but this is also circumduction. If anybody knows how to differentiate in terms of terminology, please let me know. And that's your little shoulder joint rudimentary introductory lesson.